Hi, everyone. Welcome to week 5. This week, we're going to be focusing on caring for vulnerable populations. I'm Dr. Pauline Stolzner. Let's get started. This week, we focus on populations often overlooked, misunderstood, or marginalized by our healthcare system. These include LGBTQIA+ individuals, people who are unhoused, immigrants, and more. Vulnerability in healthcare isn't about weakness. It's about how systems treat people. Let's define what we mean by vulnerability. A person isn't inherently vulnerable. Systems and structures make them vulnerable. Vulnerability happens when people face more barriers than supports in accessing care. Think of it as exposure to risk without the buffer of resources. Have you ever had to care for a patient with multiple social or systemic challenges at once? LGBTQIA+ patients often face discrimination, misgendering, or providers who simply don't understand their needs. This results in higher rates of mental health issues, suicide, and medical avoidance. Nurses must use inclusive language, honor identities, and actively work against heteronormative assumptions. Next, let's talk about immigrant communities and the unique barriers they face. Many immigrants face fear, language barriers, cultural mismatches, and lack of insurance. So some avoid care altogether due to concerns about documentation or deportation. Nurses can be a powerful bridge, using interpreters, building trust, and connecting families with local resources. Have you ever worked with a patient who declined care because they were afraid of being reported? Being unhoused creates massive barriers. No ID, no transportation, no safe place to store meds. There's also stigma. Healthcare workers may treat unhoused people as non-compliant or undeserving. Trauma-informed, non-judgmental care is essential. So how do we make care more respectful and inclusive for everyone? Cultural humility is a mindset. It's about listening, learning, and checking our own biases. We don't assume to know someone's experience. We ask, with respect. It's a lifelong practice, not a checklist. What's one way you could apply cultural humility in your own patient interactions? Nurses can advocate by connecting patients to services, case managers, food banks, housing resources, interpreters. Documenting social needs in the chart can help the whole care team respond more holistically. Advocacy is part of our role, not extra, not optional. And to advocate well, we have to build trust. Trust isn't automatic. It's earned. Small actions matter. Asking how someone wants to be addressed, following up on a promise, listening without judgment. Respecting identity, using preferred pronouns, and being consistent can transform a patient's experience. Can you recall a time when you earned a patient's trust in a tough situation? Think back on your clinical experiences. Where have you seen patients fall through the cracks? What barriers did they face that weren't medical? And most importantly, how can you advocate better for those patients going forward? Vulnerability isn't about weakness. It's about where the system needs to be stronger. Be the nurse who strengthens the system by seeing the whole person.